Penicillin. The discovery of penicillin in 1928 by Alexander Fleming revolutionized the field of medicine, heralding the dawn of antibiotics and transforming the treatment of bacterial infections. Fleming's serendipitous observation of mold-inhibiting bacterial growth paved the way for further research, leading to the purification and mass production of penicillin during World War II. This breakthrough marked a turning point, as previously deadly infections became curable with the introduction of this wonder drug. Penicillin's impact on public health was profound, drastically reducing morbidity and mortality associated with bacterial diseases. Common infections like pneumonia, meningitis, and septicemia, which once posed significant threats to human life, could now be effectively treated with penicillin. Surgical procedures became safer, as the risk of post-operative infections diminished, allowing for more extensive and successful interventions. The widespread availability of penicillin transformed healthcare practices, enabling healthcare providers to combat infectious diseases with unprecedented success. However, the overuse and misuse of antibiotics, including penicillin, have led to the emergence of antibiotic-resistant bacteria, posing a significant challenge to global health. Antibiotic resistance threatens to undo many of the gains made in the fight against infectious diseases, emphasizing the importance of responsible antibiotic use and the development of new antimicrobial agents. Despite these challenges, penicillin's discovery remains a landmark achievement in medical history, demonstrating the power of scientific innovation to improve human health and save lives. Chemotherapy. In most cases, cancer arises from a cluster of cells in a specific region that undergoes a mutation, preventing their natural cell death and causing them to proliferate unchecked, disregarding the body's normal regulatory mechanisms. Chemotherapy aims to disrupt this rapid cell division characteristic of cancer cells. While healthy cells in the body divide in an orderly and controlled manner, cancer cells divide rapidly and indiscriminately. There exist numerous chemotherapy drugs, each employing diverse mechanisms to combat cancer. Typically, these drugs target the genes or molecules crucial for cancer cells' uncontrolled division, thereby impeding their growth. By intervening at critical stages of rapid division, chemotherapy can effectively restrain or manage tumor progression and metastasis. These drugs circulate throughout the body, reaching cancer cells even if they have migrated from the original tumor site. However, chemotherapy is not devoid of side effects. Sometimes it can be likened to hammering a nail into a door, but due to the uncertainty of the hammer's accuracy, an additional drone strike may be employed to ensure thorough destruction. In this analogy, while the nail is hammered in, collateral damage occurs, affecting other cells like hair or skin, resulting in the characteristic pale appearance often associated with chemotherapy recipients. Anesthesia. In 1808, facing the grim reality of poor hygiene and ill-fitting shoes, your feet become plagued with jiggers and fungus, deteriorating your toes and threatening to spread further. The only recourse seems to be amputation. As you await the surgeon's arrival, you hope for anesthesia, though the year reminds you of the lack thereof. Instead, you brace for the agony, knowing only the crudest methods await, such as biting down on a leather strap as the bone saw approaches. However, by the 1840s, a breakthrough emerged. William Morton, a dentist from Boston, delved into experimenting with laughing gas and ether, substances known for inducing insensibility. Following successful trials, including one on himself and a dog, Morton orchestrated a pivotal moment in medical history. In 1846, at Massachusetts General Hospital, a patient underwent surgery under ether vapor, experiencing painless unconsciousness. This event marked a milestone, heralding the dawn of modern anesthesia, as patients could now undergo procedures without suffering and retain no memory of the ordeal upon awakening. Smallpox Vaccine. A vaccine that didn't even exist for a disease eradicated in 1980 may not seem like a groundbreaking medical achievement to those born after 1981. Nonetheless, the significance of smallpox is profound, even for subsequent generations. Before its eradication, smallpox claimed the lives of an estimated 300 to 500 million individuals in the 20th century alone. Particularly devastating was its impact on Native American populations following European contact, with some regions experiencing population declines of up to 90%. Surviving smallpox was no small feat. Even for those who endured its agonizing symptoms, about 2/3 faced permanent scarring or blindness. The smallpox vaccine, developed in 1796 by English physician Edward Jenner, marked a turning point. Jenner's insight stemmed from observing milkmaids, who after contracting the milder cowpox virus, gained immunity to smallpox. On May 14, 1796, Jenner inoculated an 8-year-old boy named James Phipps with pus from a cowpox blister. Phipps experienced only mild symptoms, if any. Later that year, when exposed to smallpox, Phipps remained unaffected, demonstrating the efficacy of Jenner's breakthrough. This pioneering approach laid the foundation for vaccination, and played a pivotal role in eventually eradicating one of humanity's deadliest diseases, polio vaccine. The success of a vaccine is evident when a significant portion of the population lacks awareness of why they received it in the first place, and the case of polio is no exception. In the early 20th century, this virus posed a severe threat in the United States, causing widespread endemic outbreaks that led to childhood disability, paralysis, and reliance on iron lung machines for breathing support. Polio transmission occurred through various means, including saliva, coughing, mucus, and contaminated water, instilling fear across communities. However, in 1952, a breakthrough occurred thanks to the efforts of Jonas Salk, a researcher at the University of Pittsburgh. Despite initial skepticism, Salk achieved the seemingly impossible after extensive experimentation with killed poliovirus samples. He successfully developed a vaccine capable of providing safe immunity. Subsequently, a large-scale field trial commenced, immunizing nearly 2 million American children with what became known as the Salk vaccine. Notably, Salk's decision not to patent the vaccine stands out as a remarkable act of altruism. Despite the immense financial potential, Salk believed in the universal accessibility of the vaccine, refusing personal gain to ensure widespread distribution. This selfless act underscored his dedication to public health and the collective well-being of society. Germ theory. Before the discovery of bacteria, prevailing beliefs about illness revolved around the concept of humors and miasma, or foul air. The prevailing notion was that inhaling the noxious odor of decaying matter, such as rotting flesh, could lead to illness, including the plague. Any suggestion to the contrary was often met with resistance, deemed heretical, or dismissed as madness. Ignaz Semmelweis encountered such resistance when he observed surgeons transitioning from performing autopsies to delivering babies without washing their hands, leading to a rise in infant mortality. When he proposed the simple solution of hand washing with a cleaning solution before entering the delivery room, he faced ridicule and rejection from his peers. Around the same period, French chemist Louis Pasteur conducted groundbreaking experiments that supported Semmelweis's insights. Through his research on fermentation and food spoilage, Pasteur formulated the germ theory, demonstrating that tiny living organisms, already present, were responsible for these processes. This provided empirical evidence supporting Semmelweis's assertions and underscored the importance of hygiene in preventing infections. X-rays. While conducting experiments with cathode ray tubes in his laboratory, physics professor Wilhelm Röntgen serendipitously made a significant discovery on November 8, 1895. He observed a fluorescent glow emanating from a nearby chemically coated screen. It became apparent to Röntgen that these cathode rays were producing a previously unseen form of radiation, capable of passing through the cardboard covering the tube. When Röntgen inserted his hand into the path of these mysterious X-rays, he was astonished to witness an eerie shadow of his bones projected onto the plate. This revelation sparked a flurry of thoughts and possibilities in Röntgen's mind. He swiftly directed the X-ray beam at various objects, including a book, a deck of cards, and even his wife's hand and ring. The X-ray's unique ability to penetrate and create images of the body's internal structure was nothing short of remarkable. For the first time, physicians gained the ability to visualize internal organs, bones, foreign objects like bullets, and tumors within living patients, all without resorting to surgery. Previously, inaccessible fractures could now be diagnosed and treated effectively. However, unbeknownst to Röntgen at the time, his exposure to these X-rays subjected him to lethal levels of radiation, eventually leading to his own battle with cancer. Antiseptic. For centuries, hospitals worldwide were notorious for exacerbating minor illnesses into life-threatening conditions. To provide further context, consider a scenario where a patient arrived with a wound infected from battle. Monks from Oxford, tasked with tending to such wounds, would apply herbs and sometimes even goat dung to promote pus formation, believing it to be a positive indicator. These hospitals were characterized by filth and poor hygiene practices. Doctors seldom washed their hands, and surgeons routinely reused unclean tools on multiple patients. Consequently, up to 50% of patients undergoing amputation succumbed to sepsis, a condition where bacteria introduced into the wound led to widespread organ failure. In the 1800s, surgeon Joseph Lister of Glasgow, Scotland, confronted the alarming mortality rates associated with surgery. Influenced by Louis Pasteur's germ theory, Lister implemented significant reforms. He introduced carbolic acid spray as an antiseptic in operating rooms to eradicate bacteria, and insisted on thorough cleaning of surgical instruments after each procedure. Additionally, Lister advocated for meticulous wound cleansing using the same antiseptic solution, revolutionizing surgical practices and significantly reducing the risk of post-operative infections. DNA sequencing. For centuries, the instructions governing the construction and functioning of living organisms remained an enigmatic puzzle, akin to deciphering a book composed in an unfamiliar language. It seemed as though God had concealed the methods of creation behind countless proteins, rendering them indecipherable to human comprehension. However, in the latter part of the 20th century, scientists achieved a monumental breakthrough by unraveling this intricate code and mastering the ability to interpret these instructions encoded within DNA. Similar to the arrangement of letters forming words in a book, DNA consists of chemical letters, A, C, G, and T, arranged in precise sequences, spelling out the genetic information encoded in genes. Through DNA sequencing, scientists gained the capability to decode these sequences, letter by letter, akin to gradually unveiling the contents of an untitled and authorless book. This breakthrough enabled them to comprehend and interpret the underlying messages inscribed within DNA, rather than merely confronting a jumble of scrambled letters. Initially, deciphering DNA sequences presented immense challenges, requiring years of diligent effort to decode even minute sections. However, the advent of DNA sequencing held immense promise, opening avenues for diverse possibilities ranging from potential cancer treatments and improved agricultural crops to unlocking the secrets of longevity. By comparing our DNA with that of other species, we could potentially uncover hidden insights and revelations, paving the way for transformative advancements in various fields of science and medicine. Organ transplantation. For a considerable period, the failure of vital organs like the heart, lungs, or kidneys typically spelled an inevitable death sentence. The complexity and difficulty in repairing these body parts, once damaged by factors such as cancer or excessive alcohol consumption, seemed insurmountable. However, as medical knowledge advanced over time, the realm of possibility expanded to include more ambitious interventions, such as organ transplants. An organ transplant can be likened to the replacement of a faulty engine or battery in a vital machine, restoring its proper function with a new, functional component. In the case of organ transplantation, the machine is the human body, and the replaced components may include the heart, liver, lungs, and other organs. Initially, the concept appeared incredibly daring and fraught with risks. How could one feasibly transfer a living organism from one person to another and expect seamless integration? The body perceives these transplanted organs as foreign entities, akin to threats, since it never produced them originally. Consequently, early transplant endeavors often ended in failure, with patients' immune systems mounting attacks against and rejecting the foreign organs. However, through decades of dedicated research, doctors made significant strides. They developed anti-rejection medications and refined surgical techniques, enhancing the success rate of organ transplants. These advancements enabled medical professionals to transfer organs more effectively while minimizing the risk of rejection, ultimately offering hope and extended life to countless individuals in need. MRI. Years following the discovery of X-rays, peering into the inner workings of the human body resembled navigating a labyrinth while blindfolded, intoxicated, and walking backward. Although X-rays provided some insight, numerous areas remained obstructed from view. While a tumor in the skull might be discernible, pinpointing its precise location was often left to the conjecture of surgeons. In contrast, an MRI operates akin to an exceptionally advanced camera, capable of capturing highly detailed 3D images, utilizing potent magnetic fields and radio waves instead of light. Unlike conventional imaging methods that merely depict surface features, an MRI offers clear visuals that enable examination of the body's interior from various perspectives. It's akin to having the ability to strip away all layers of a house, walls, ceilings, and floors, simultaneously to inspect its underlying framework, plumbing, electrical wiring, and concealed infrastructure while it remains intact and operational. Before the advent of MRIs, certain regions such as the brain, spinal cord, joints, and soft tissues remained obscure, even with X-rays or early computed tomography (CT) scans. However, by harnessing magnetic fields safely, radiologists could now produce remarkably clear cross-sectional images of these previously elusive areas from multiple vantage points. Gene therapy. Your identity, from your physical appearance to your personality traits and preferences, is largely shaped by specific genes encoded within your DNA. Essentially, you are a walking, talking genetic blueprint, embodying hopes, desires, and dreams. However, for many genetic diseases, the root cause lies in defective blueprints guiding cells to produce essential proteins or enzymes. This flaw perpetuates, leading to disorders such as cystic fibrosis, hemophilia, and certain cancers. Conventional medicine could only manage the symptoms without addressing the underlying issue. Then came a revolutionary therapy capable of rewriting these flawed instructions: gene therapy. Gene therapy is akin to revising the body's original architectural plans, pinpointing errors, specifying the construction of ineffective or dysfunctional components, and editing them with accurate details. It's akin to identifying a design flaw early on, preventing the production of countless defective products. Rather than merely managing symptoms, gene therapy introduces functional genes into a patient's cells to compensate for the faulty ones, effectively overriding the flawed code with a master correction file. Various approaches exist in gene therapy. Some utilize harmless viruses as biological carriers to transport therapeutic genes into targeted cells, while others employ microscopic fat bubbles to deliver the genetic cargo across cellular membranes. Once the corrected genes are inside the cells, they produce functional proteins based on the updated blueprint, restoring proper functionality to biological processes. This development brings hope for individuals affected by genetic conditions, offering the prospect of a brighter future.